Question 6. Which of the following is the most likely cause of this patient's symptoms? Again, unhelpful in this case, but that's okay. Let's take a look at the answer choices. Hypovolemia, cardiac arrhythmia, vestibular dysfunction, autonomic neuropathy, vasovagal response. Okay, probably a cardio question, if I already guessed. So let's go ahead and read through the stem here. 67-year-old man presents with episodes of lightheadedness that occur when getting out of bed or rising after sitting for long periods. Okay, so that immediately sounds like orthostatic hypotension, right? Please tell me that's what you're thinking. Denies chest pain or palpitations. His past medical history includes hypertension, type 2 diabetes. Meds include lisinopril, insulin glargine. On standing, his blood pressure drops from 138/82 to 102. Okay, exactly. So there's our orthostatic hypotension, and his heart rate remains unchanged. Strength and sensation are intact. No tremor or rigidity is noted. Cool. So, I mean, it's just a classic orthostatic hypotension question. This comes up all the time. This is definitely one of the higher yield concepts. So let's go ahead and think through this here. When we think orthostatic hypotension, what's the first thing that comes to mind, like in terms of causes? I hope you said in your Dora Explorer voice, hypovolemia, right? I hope you said that because this is classically the cause of orthostatic hypotension. Okay, so I would be inclined to probably just pick that one and move on, but I'm a good test taker, so I'm not going to do that. I'm going to read through every answer choice first and just double check that there's no better answer. Cardiac arrhythmia, probably not. They said he has no chest pain, no palpitations, and usually arrhythmias can cause chest pain or palpitations or the an irregular rhythm. So I'm going to assume that there's no cardiac arrhythmia here. Again, this is my probably not. Vestibular dysfunction. That's an interesting one. So like inner ear, cranial nerve 8, some neurology stuff I'm too dumb to understand. I really don't see anything that implies a neuro cause here. They don't mention really any neuro tests. They don't do any of the cerebellar tests. All they do is strength and sensation, tremor, and no tremor rigidity. So there's really not much to go off of for the vestibular dysfunction. So I am probably just not going to do anything. It's probably a probably not one. But even, if I'm really not sure, I'll just leave it and move on to the next one. D, autonomic neuropathy. Autonomic neuropathy. Okay, so the autonomic system isn't working. Is that even possible in this patient? Well, they told us he has type 2 diabetes. Diabetes causes neuropathy, so maybe that's possible. How would that affect his blood pressure? Well, when you stand up, what's supposed to happen to your blood pressure? I'll tell you, it's certainly not supposed to drop 36 points. Your blood pressure is supposed to stay at least the same, if not rise, when you stand up, because now you have decreased preload. So when you stand up, normally your blood pressure might drop a little bit, but it's certainly not supposed to drop 36 points, which is what happens here. I think we talked about in an earlier question that when you stand up, you decrease your preload. So that's why this can happen. But the neurological system is supposed to kick in and tell your heart, whoa, hang on, we got to start working harder here. So you're supposed to get more sympathetic tone to the heart, which is then supposed to maintain your blood pressure. But if you did not get that sympathetic tone, then yeah, your blood pressure could drop. So now we're thinking, oh crap. A, probably right. D, maybe also right. So let's come back to this one. Between C and D, I'm definitely favoring D, and between A and C, I'm definitely favoring A. So I'm just going to say, yeah, probably not for vestibular dysfunction. There are two better answer choices, so it's probably not that one. What about vasovagal? Vasovagal response is loss of consciousness due to pain or stressful stimuli. There's nothing causing him to vasovagal here. There's no pain, there's no stress. That's not it. So that's a hard cross off for me. So A, most likely. D, technically possible. How do we tell the difference? It's very simple. It's hard to think about, but this was a really, really tricky logic question. If you think about it, like I said, when you stand up, you're supposed to get more sympathetic tone to your vasculature and to your heart to maintain your blood pressure. But if you didn't, your blood pressure can fall, right? Obvious. Okay, so normally, let's say we have hypovolemia, orthostatic hypotension. Our sympathetics are still working. So what's that going to do to the heart, right? Cardiac output is the formula we're talking about here. All right, your blood pressure is a function of this. it's both heart rate and stroke volume. So if we have increased, so again, the problem when you stand up is suddenly your stroke volume falls. Okay, so this is the problem. Decreased preload, less stroke volume. Sympathetics are supposed to make your heart rate increase. So this is why people with hypovolemic orthostatic hypotension tend to get tachycardic alongside their hypotension. But this guy, his heart rate remains unchanged. That's the crazy part. Okay, remember I said medicine's not that hard? It is kind of hard sometimes. So you had to think about that. The autonomics are not kicking in because the heart rate did not increase. It should increase your heart rate, chronotropy, and inotropy, which is the stroke volume. But if we don't see this, then it's probably an autonomic problem. The answer is D.